How did lymph node biopsies become minimally invasive? Imagine a time when removing lymph nodes meant a big, open surgery with lots of recovery time. Over the years, doctors have worked hard to make this process safer and easier for patients. The key breakthrough came with the development of the Sentinel lymph node biopsy technique. This method focuses on finding and removing only the first lymph node or nodes that drain fluid from a tumor site. These are called Sentinel nodes because they are the first stop for cancer cells trying to spread. By targeting just these nodes, surgeons can get the information they need without removing many lymph nodes, which reduces pain, swelling, and other complications. The idea of sentinel lymph nodes is based on understanding that cancer spreads in an orderly way through lymphatic channels. Researchers in the 1960s and 1970s studied how lymphatic drainage works and found that cancer cells tend to go to specific regional lymph nodes first. In 1951, the first sentinel lymph node biopsy was performed during a parotid gland surgery, but it didn't become widely used until later. In 1977, a doctor named Cabanas used blue dye to identify sentinel nodes in patients with penile cancer. This was a big step because it showed that you could find the first lymph node with simple tools. In the early 1990s, surgeons like Morton started using blue dye and radioactive tracers during operations for melanoma, a type of skin cancer. These tools helped them see exactly which lymph nodes were the first to receive drainage from the tumor. This process, called intraoperative lymphatic mapping, allowed surgeons to remove only the sentinel nodes instead of doing a full lymph node dissection. This approach proved to be just as effective at staging the cancer but much less invasive. Soon after, the technique was adapted for breast cancer, with surgeons like Giuliano showing it was safe and reliable. Because of its success, sentinel lymph node biopsy became a standard procedure for many cancers, including head and neck cancers and lymphomas. The main benefit was clear: fewer complications, less pain, and quicker recovery, all while still providing accurate information about whether the cancer had spread. In the case of non-Hodgkin lymphoma, traditional lymph node biopsies are still important for diagnosis. But the principles of minimally invasive techniques have influenced newer methods like fine needle aspiration and core needle biopsy. These less invasive procedures can often be done in outpatient settings, causing less discomfort and risk for patients. So, the shift toward minimally invasive lymph node biopsies happened because of better understanding of lymphatic drainage, innovative use of dyes and tracers, and solid clinical evidence that targeting sentinel nodes works just as well as more extensive surgery. This evolution has helped doctors diagnose and stage cancers more accurately while making the experience easier for patients. Always remember, if you're facing a lymph node biopsy, your healthcare team can guide you on the best approach for your specific situation.